Your kid is sick, they have a cold, and they have a fever. You're not sure what to expect or when to be concerned. My name's Alec. I'm a board certified pediatrician. I see the common colds in kids literally all day, every day, all the time, and I'm going to go over what to expect and when to be concerned. So, major caveat here. I find it really hard to make a video about fevers because there's so many factors that go into when to be concerned and when we can watchfully wait. So for instance, if you're an infant and you're less than 60 days and you have a temperature greater than 100.4, okay, major stop. This video is not for you. That is a medical emergency. Please seek medical evaluation. Same if you have a major underlying medical condition, or you have on chemotherapy, or you have a central line, or your immune system's not intact, or you don't have a spleen, okay? These things, fever is medical emergency. Go check it out. And this video does not apply to you, okay? This video applies to healthy kids with no underlying medical conditions who have a viral illness or a cold that's uncomplicated. There's no bacterial process going on, okay? Now, when you have a cold and you're less than 6 years old, you can see up to 14 days of symptoms from a cold. But a fever should not last that long. So in general, it lasts 2 to 3-ish days. What can you do for fever? Tylenol, and if you're greater than 6 months old, ibuprofen. Do you have to give meds if your kid has a fever from a cold that's uncomplicated and is otherwise healthy? No. If they have a temperature of 103 and they're running around and happy, you don't have to use these meds. If your kid is uncomfortable or in pain or discomfort, consider it, right? As long as there's no contraindications to these meds, they can be great. They can be very helpful. And so when to be concerned? Okay. This is really hard. There's so many symptoms. I can't list them all as to when to be concerned. So if you're ever in doubt, please reach out to your healthcare provider. Some common ones I see. Okay, you have a fever from a cold. It goes away for a while, like a day or two, and then it comes back. Okay, signs to be evaluated. Could be a sign that a bacteria slipped in somewhere. 2, you have fever for more than 5 days. So that is a temperature greater than 100.4 every single day for 5 days. I don't care how well you look, you should be evaluated. We need to think about other things going on besides a cold. Altered mental status. So your kid is so irritable, inconsolable, or you're on the other end of the spectrum and you are so sleepy and so tired, needs to be evaluated. Horrible headache, stiff neck, evaluated. Severe sore throat, muffled voice, drooling, can't tolerate liquids, needs to be evaluated. Shortness of breath, needs to be evaluated. Really severe abdominal pain, or you're vomiting and having diarrhea so much you cannot stay hydrated, needs to be evaluated. Your urine output is dropping off, a sign of dehydration, should be evaluated. Those are the most common ones I see, but if you're ever in doubt, please seek medical attention. So I hope this helps give you sort of an idea of what to expect for fevers in a viral illness in an otherwise healthy kid and when to be concerned. So please follow along for more evidence-based pediatric health education.